Hello everyone, this is Dr. Julian Escobar, and today we're discussing success rates, pregnancy rates. As a baseline, I'd like to talk about natural fertility. If you're perfect and you're in your 20s, you get a maximum of 20 to 25% chance of pregnancy per month. At age 35, it's all the way down to about 12%, and at age 40, about 5%. The same trend with age, we're going to see whether you get pregnant with insemination or IVF. However, the numbers are quite different. Obviously, patients who need insemination have much lower fertility rates baseline. So with insemination, you get about a 15%. It could be a little bit higher with aggressive protocols and very short term of infertility and an evaluation that is vastly normal, to much lower, obviously, with older patients who've had a prolonged infertility. So these will vary. There's excellent data for IVF, however, as all clinics in the US are lucky enough to have to report this data to the government. And so you can easily find that. However, they're very difficult to compare, as some clinics transfer 2 embryos and another clinic transfers 1 embryo. So if you're just looking at pregnancy rates, you don't really know. Implantation rate gives you a better idea. So the number of actual embryos that you transferred that implant. And so on average in the US, you'll have, for good prognosis patients under 35, an implantation rate above 40%. If you go up to the next year, 35 to 37 years of age, it's about 30%. Then 38 to 40 is about 20%, and above 40 is a little bit less than 10%. If we, however, use the advantage of techniques such as PGS, we can really, in our clinic, for example, increase that implantation rate to about 70%. And if we add other modalities before the embryo transfer, we can go up to 80%. So we've really increased the chances of implantation, and therefore we don't have to transfer usually more than 1 embryo. We can decrease the level of twins, so we can also improve your chances not only of pregnancy, but a very healthy pregnancy, full-term delivery, low complications, which is ultimately our goal. And finally, what we really focus on is not just on doing a cycle and getting you pregnant, but hopefully to help you design the appropriate program for you to build your family. So obviously this is going to change if you only want to have 1 child versus if you want to have 5, and also in what period of time, and all the other variables that we can include in this somewhat complicated treatment. So take care, bye-bye.